Hello, everyone. My name is Jeannie Linky Northrop. I'm a managing editor with Pharmaceutical Executive, and I'd like to welcome you to today's broadcast, Understanding Healthcare Access Barriers, Industry Trends, and the Patient Assistance Approach, sponsored by Assessia Health. Assessia Health is a nonprofit patient assistance organization that supports individuals living with rare and chronic health conditions. Through its 75 plus disease programs, Assessia Health offers case management, financial assistance, education, and other related services. They have a holistic, inclusive, and outcomes-focused approach that addresses unmet needs and improves access to healthcare. We have a really great presentation planned today. Before we begin, I just have a few important announcements I'd like to make. First and foremost, this webcast is designed to be interactive, and so we encourage you to ask questions throughout the event. You can submit any questions you have by typing them in the Q&A box. That can be found at the bottom of your video player. You can enlarge your slide window by clicking on the small icon in the bottom right corner of the media player. Please note, however, that all slides will advance automatically throughout the event. If you do experience any technical problems viewing or hearing this presentation, simply click on the question mark help widget in the top right of your presentation window. I would now like to welcome and introduce today's presenters, Tiara Green and Craig Martin. Appointed interim CEO at Assessia in June of 2023, Tiara brings in-depth expertise to the role, including previous work with the state health department and national nonprofit organizations. Her experience spans a variety of focuses, including health insurance enrollment, diabetes, sickle cell diseases, preconception health, and overall wellness. She has been with the company since 2013 and has provided support via a range of different roles. She's a past program manager, was a director of operations, then moved up to be a VP of operations and proceeded to be a senior VP of programs and policy with Assessia. Tiara's visionary mindset and a decade of organizational knowledge have assisted Assessia Health in growing its health education offerings to patients. Tiara, welcome. We also have Craig joining us today. Craig is president of Rhythm Health, which he founded in 2018 to provide executive services and strategy, business development, partnering, and communications counseling for growing companies in the biotech and health technology realms. Craig's background includes nearly 3 decades of experience in consulting across health, life sciences, technology, and healthcare markets, working with industry providers, patient groups, and government institutions. Having worked extensively over the past 2 decades in the rare disease space and in precision medicine, Craig previously served as interim CEO of Global Genes. His history with the organization dates back more than a decade and includes serving as chair of the organization's corporate alliance for 5 years. He was also on the board of directors with the same alliance for more than 5 years. Craig has also worked as global principal for biotech and health technology with Ogilvy Consulting, and he served as CEO of Ogilvy's Feinstein Kane Healthcare, a specialized consultancy focused in biotech, biotechnology, and related fields. Craig has held leadership positions within health and life science-focused businesses based in Cambridge, Washington, D.C., New York, as well as Brussels. He's a frequent commentator and panelist, and he's used to speaking about key issues impacting innovation in rare disease. Craig, welcome. It's also a pleasure to have you with us today. So that said, Tiara, go ahead. Feel free to kick off today's presentation.
Thank you so much, Jeannie. We're excited to be here today to share information about the state of healthcare and patient assistance. Just to give a quick overview of what we'll be discussing today, we're going to spend some time talking about the state of healthcare, then going into some leading causes of death and disability in our nation, followed by some key barriers and trends. And then we'll start talking about latest developments. How do we strategize to impact and decrease some of the health inequities that exist in our country today? As Jeannie mentioned, Assessia Health is a national nonprofit organization. We are an independent charitable patient assistance organization that assists individuals with rare and chronic conditions afford their health care. We understand the complicated healthcare landscape, and our goal is really to provide some financial relief as patients go along in their healthcare journey. We do so in ways by assisting with the cost of copays for their medications. We assist with their health insurance premiums, medical expenses, thinking about the whole person and that holistic approach that you mentioned. Medical expenses include copays for lab testing, durable medical equipment, physician office copays, and then we round it out by paying for travel. We know that one of the biggest barriers to accessing healthcare is simply getting to the physician's office. We are excited that we can continue to serve those patients each and every day. And for many, this means that they do not have to make the decision between paying for their health care or paying for other household expenses that they need simply to live. While this may seem a little extreme, unfortunately, many find themselves in this very scenario. So if we take a look at our healthcare in the US and we compare it to other high-income countries like Canada, Germany, Korea, the UK, we have a higher healthcare spending per person, but we have a low life expectancy at birth and then a high mortality rate for avoidable or treatable conditions. And some of those avoidable or treatable conditions impact 4 in 10 individuals in the US, meaning they have 2 or more chronic conditions. The definition of a chronic condition or chronic disease is really lasting more than a year. It requires ongoing medical attention. It may limit activities of daily living or a combination of both of those. So here we are as a high-income country. However, we are one of the only countries that do not guarantee healthcare coverage. So we have a split of insurance with 65% of Americans having commercial or private insurance and thinking about employer-based coverage. Insurance that is purchased through a marketplace would be commercial, and then 36% with federal or public insurance, which is the Medicare, Medicaid, and TRICARE population. If we look at these leading causes of death and disability, according to CDC, we know that they are drivers of our $4.1 trillion healthcare costs that we have on an annual basis. Heart disease, cancer, stroke, and then if we think about rare diseases collectively, the dollar amount starts to increase. And we want individuals to be able to afford their care. Many of these conditions are avoidable, meaning they're caused by tobacco use, poor nutrition, and a sedentary lifestyle. And if we take that one piece of that sedentary lifestyle or physical activity, even short periods of activity can improve overall health. However, some have to think about how they are going to be able to do so. Lack of time with working poor income families, unsafe neighborhoods, and lack of access. And it's just difficult to become or even remain physically active when they're thinking about so many other strains or requirements that they have to answer to in their everyday life. This is where the social determinants of health come into place, and we'll talk about that a little later as well.
Thank you,
Greg.
Thank you, Tiara. So, as Tiara alluded to, the cost of healthcare is something that has been much discussed. But I think importantly, we want to try and look at it in the context of how it affects different communities of patients and how it relates to the kinds of services that Accessia Health provides for those populations. So if you look at the chart in the upper left on this slide, it shows a dramatically increasing trend line in terms of overall costs and health expenditures. What that doesn't show is other costs that are increasing in conjunction with healthcare costs. And what that results in is an environment in which you may be forced to make decisions about what you can pay for and what you can't. And even amounts that might have seemed less significant not too long ago are now very significant because many Americans are living paycheck to paycheck. Lower income Americans are particularly stressed. We saw a statistic in just January of this year, 44% of Americans can't cover a $1,000 emergency expense. And, when you think about that, particularly in a medical context, it's pretty easy for a $1,000 expense to arise. And so this is just increasing the level of pressure on many Americans. And if you look at the trend lines in the chart in the upper right, this affects lower income Americans the most. And you can see that there's more than a third of those Americans have put off medical care over the last 12 months because of concerns about their ability to pay. And not far behind that now are middle income Americans. So these are people that may be underinsured or have had to make some choices about where they're spending their money they're putting them in a situation as well where they're putting off paying for medical treatments that in this instance are potentially very serious. And that's important as well because in putting off those treatments, they may end up with a worse outcome that's even more costly. And that might result in a prolonged hospital stay and other burdens on them, on their families, and on the healthcare system. We're also seeing collectively a record number of people in the U.S., 38%, putting off medical treatment due to the cost. So that means, more than 1 in 3 of us is making a decision that we can't afford to get the treatment that we need for our condition area. And for those with medical debt, we're seeing a large number that are cutting back on things like food. And in that instance, what they might be doing is, in order to control expenses, maybe they're relying on processed foods or fast food, where they're not getting the nutritional benefits that they may need. And that may cause their health to deteriorate even more in combination with not getting the treatment that they need for a particular condition. One of the other things that you see here is that a significant percentage overall have sought help from a charity or a nonprofit to assist them in paying for their medical costs. And that's why you see the burden on organizations like Accessia Health. Many of the fund areas that we have are, they're waitlist. They're people really trying to get help that can't because there may not be sufficient funds available.
Thank you, Craig. Great points. And I have a question based on what you're both telling me. I think both of you have different roles in the industry slightly, but you're hearing the same thing. And honestly, it's something that doesn't come as a shock to me. Everything you said, even the statistics, I think we all see it daily, right? So what do you feel is the biggest hurdle to providing more of a widespread patient assistance program or better providing support to them to better address and scale the complexity of these needs?
I'll take that one first. As a independent charitable organization, it's always going to be funding, right? We are able to assist individuals because of the generosity of our donors. And our goal is always to assist as many individuals as possible. But as Craig said, we end up with long wait lists. Being able to afford care for those with rare conditions is expensive. This means that as a nonprofit, we make every effort to stretch the dollars that we receive, but we can always use more.
Yeah, I would also say that, we're seeing some changes in the types of assistance that patients and families now require. And some of that's driven by more advanced medicines that are oftentimes biologics. And what that means is instead of going to your local pharmacy and picking up tablets or capsules that you can take at home or having them sent directly to your home, you oftentimes would have to go to a medical specialist and have an injection or an infusion administered at that location. And that puts a lot of stress on lower income families in particular, because it may mean taking time off work. It may mean having to figure out how I'm going to travel to that location to have that medication administered. And so in an environment where people are already making choices about delaying medical treatment, it creates a situation where many are more likely to defer. And what that means and why that's bad for everyone in the system is then they aren't adherent to their treatment. And that results in worse outcomes and bigger health disparities.
Well said, well said, especially in the face of chronic and rare disease, where, as you were alluding to, some of these more complex molecules are in drug development and are being utilized.
Yep, exactly. So I also wanted to talk about a few other trends that are specifically evident amongst the populations that Accessia Health often serves. So when you start to look at lower income adults that are cutting back, you're seeing 70% cutting back on food and other basic necessities. That's a huge number. You're also seeing in certain populations, like more than 50% of Black, lower income, and uninsured have more than $10,000 in healthcare debt. So any amount that you're adding to what they're already experiencing from a financial perspective is likely to cause them to push off getting treatment if they don't have the right type of assistance. And a large number, as you see, 32% are seeking help from organizations like Accessia Health. And so it's critically important that we continue to support these patient assistance programs because the demand is increasing substantially. And there are fewer and fewer options or places that people can turn to other than debt to support their medical needs. And this is expanding beyond lower income, even into middle income and other Americans. So for that reason, we really have to pay close attention to what's going on and not assume that most Americans are going to be able to afford the treatments that they need.
So another question then, how do the pressures associated with healthcare expenses manifest distinctly among the lower income and underserved populations? What are some of the potential consequences of this?
Well, Tiara, I'll jump in first and then please chime in as well. But I think when you're in an environment like we are, where everybody is under increasing pressure, you see that manifest itself particularly severely amongst lower income Americans. And they're the most likely to sacrifice their health when the trade-off is putting food on the table or taking care of other basic needs, keeping a roof over your head, versus getting treatment for a condition. And this is not only true amongst certain populations that have historically been disadvantaged. It's also true in rural communities where it may be very difficult for them to access support services or assistance or even a medical professional that they might need. And then, you've got in many areas that are urban, treatment deserts. So you lack access to the types of specialists that would be helpful in treating the disease, and you can't afford to travel to a place where you might be able to access the right type of specialist or get the right type of treatment. So the consequences of that further downstream are fewer and fewer people of lower income getting the treatment that they need, which will result in worse outcomes and higher costs in the system because they are more likely to have a catastrophic event of some kind that will require hospitalization or longer term treatment. And so, we have to really look at this as a situation where, it's not just the near term issue of people not getting access to their treatment. It's the longer term implications of them not doing so consistently.
I think if we look at the data on this slide, it's alarming. The percentage of people that simply must choose between food, clothing, and basic items to live is extremely high. Americans have about $220 billion in medical debt, and about 3 million people owe more than $10,000 each. Unfortunately, those that have rare and chronic conditions are likely to see an increase in debt over time as they try to receive those much needed therapies that are coming out and those that are existing right now. So when households have to go into debt to pay for healthcare expenses, they choose to delay care. We know that this leads to higher morbidity, higher mortality rates, and as their conditions worsen over time, they're going to seek treatment at an emergency department instead of going to see their physician because they couldn't afford the copays in order to see their physician. And now they have this very emergent need that requires substantial health interventions. So should that or had that individual received the care they needed early on, it would have been or may have been avoided. And it becomes a domino effect. Now someone may be missing time at work. So we're talking about productivity. It's putting further strain on household expenses. And by not addressing these items now, we're doing a disservice to the nation and the people that we serve each and every day.
Well said. It really is a domino effect, and it trickles down to impacting all of us, not just the patient. Thank you so much.
Yeah, and I think also if we consider these trends, economic trends, against the bigger backdrop of other trends that are taking place, you begin to see how significantly the financial pressures can impact overall a health system. And so when we start to think about recent developments, one of the things that's happened since 2001, when we sequenced the human genome, is we've ushered in an era of precision or personalized medicine, which is really about understanding at the genetic or molecular level disease and what's going on in an individual's health. One of the key ways in which we can be more precise and personalized in how we treat individuals is by leveraging whole genome or whole exome based sequencing, which helps to identify a particular mutation or other genetic anomaly that might be contributing to that patient's disease, or might help to diagnose what a patient is experiencing. If you don't have access to whole genome or whole exome sequencing, you may never get that diagnosis. And as a result, you may never get access to a clinical trial or to a treatment that could very effectively deal with your condition. And that's the other thing that we're seeing is now in this era of gene therapy, gene editing, these advanced medicines, the opportunity is there to address the underlying causes of a disease. And some of these new therapies are, nearly curative. They may allow a patient to avoid a whole host of significant expenses and implications and symptoms over a lifetime by addressing up front some of the underlying disease causing influences. And so it's important that we think about affordability and access to both the genetic testing or sequencing that will enable a person to get a diagnosis, and to the types of therapies that are most likely to be effective in treating those condition areas. And if we don't make those things affordable and accessible, health disparities are going to widen. And you can think about this in areas like sickle cell disease, where we've had some really exciting advancements and approvals of gene therapy-based treatments. But if people within the African American and Black community, which is disproportionately affected by sickle cell disease, can't get a diagnosis, they can't get access to a treatment or trial. And if they can't afford their out-of-pocket costs in order to be treated, which may require going to a facility and traveling and taking time off work, they won't see the benefits of those kinds of treatments. And so I think it's important that we think about, with these new advanced medicines, which can be costly, and with genomic testing, which also can be costly, although the prices are coming down, how do we make these things accessible in an equitable way to a broader section of the population? The Inflation Reduction Act is one of the policy interventions that's been designed to try and control the costs that each individual might have to bear, in particular amongst the Medicare population. One of the key elements of the Inflation Reduction Act was to limit the out-of-pocket expense for patients to $2,000. But as we talked about earlier, if $1,000 is unaffordable for 44% of Americans in general, $2,000 is going to put a lot of pressure on many families to be able to afford it. And as a result, they may not be taking advantage of treatment that would improve their health and address their condition. I think the other aspect of the Inflation Reduction Act is that I think for some of the pharmaceutical companies, which oftentimes fund patient assistance programs, they may view that $2,000 limit as being a sufficient protection for many of those families that traditionally have taken advantage of patient assistance programs. But when we look at the broader economic climate, clearly that's not true. So we need to continue to support the kinds of assistance programs that Accessia Health and others provide, or many of these Americans who otherwise would be able to benefit from new medicines from these companies won't be able to.
Make some really good points there, Craig. And I think, just honing in on that $2,000 cap, right, for their out-of-pocket expenses for Part D, it doesn't take into consideration the premiums that they have to pay if they have a supplemental plan, a Medicare Advantage plan, and simply getting to their appointments and their household expenses for our most fixed income Americans. $2,000 is simply unaffordable for many. And if we take it a step further outside of the IRA, but we look at the Help Copays Act, and this largely impacts those who have private insurance. It's known as Help Copays Act. It's also Help Insure Lower Patient Copays Act. And it really is to make sure that those payments made on behalf of patients from patient assistance organizations like Accessia Health, that they count towards the individual's health insurance out-of-pocket maximums. And I'll give this example of a patient assistance organization assists an individual with $5,000 of their out-of-pocket costs. Once they extend or exhaust all of the $5,000 from that patient assistance organization, it is not counted towards their out-of-pocket limit. So the patient starts back from the beginning and now have to pay that $5,000 on their own, which they simply cannot do, which is why they're with the patient assistance organization. So the Help Copays Act is really to say, count those patient assistance organization payments or payments from any other third party that is paying on the patient's behalf so that they don't have to pay it again. It's like the insurance company receiving that payment twice. And now we need just some enforcement behind it to make sure that in every state that this is something that is highly enforced so that individuals are not paying double the cost. If we look at the patient assistance model, we started this industry. This industry started really focused on copays for medications. And over time, as the healthcare landscape has changed, many of these patient assistance organizations have extended to offer travel so that patients can get to their appointments. They are offering medical expenses assistance, which I talked a little bit about earlier, and paying for health insurance premiums. If we think about the cost of health insurance premiums for those working class families, they may be spending $1,500 per month on just their premium costs. So it's important for us to think about the whole individual as we in the patient assistance industry are seeking to help as many patients as possible. So this is Accessia Health's model. We have a holistic assistance model so that we can meet the unique needs of every patient. We offer case management, and case management is really to help individuals understand their health insurance benefits. We know that health literacy is a huge impact when it comes to understanding your care, understanding what the physician is saying when you're in the room, understanding what to choose in a health insurance plan. What is a deductible? What is a copayment? We may think those things are very straightforward, but they are very complex. And if you're dealing with a rare or chronic condition, there are certain things you need to take into consideration. Where are my specialists? How far are my specialists that are in network versus out of network? And we work with individuals to better understand all of the insurance options that are out there for them. When we think about care coordination, we partner with community-based organizations so that we develop this network and everyone's working together to address social determinants of health, which I'll discuss a little further in the next slide. And then it's education. This really talks about that health literacy piece. We have a webinar series where we provide information to individuals so that they can make informed healthcare decisions. This includes having experts from several different areas or organizations, whether it's caregiving, whether it's open enrollment, or whether it's talking about Social Security disability income. We bring individuals in so that we can give our patients tools for success. And then we talked a little bit about these other types of assistance with helping pay for those health insurance premiums, co-pays, medical expenses. But that last piece here is legal services. We employ attorneys who represent patients for free as they try to appeal Social Security disability decisions. We know that a large population of those with rare conditions become disabled. So we offer this assistance so that they can adequately navigate the system and not have to worry about now the cost of paying for an attorney, number one, and number two, understanding the application process for Social Security disability. It is that holistic approach. It's individualized, and it really gets to improved healthcare outcomes. I talked a little bit about the community-based approach and partnering with other individuals or other organizations in certain areas. This is a project that we are very happy about and excited about because we understand that sometimes the zip code in which you live becomes more important than your genetic code, your genetic makeup, because every area has their own individual needs or a lack of resources that need to be addressed. So when we look at social determinants of health, we have a project in Louisville, Kentucky, where we are a partner amongst healthcare systems, those who are able to provide housing assistance, in working with community health workers who are a trusted resource in that area and can get individuals into the care that they need. One of the most alarming statistics that I've read in the past years is that only 8% of Americans are on time with their clinically recommended screenings. So when we are delaying those screenings, it means that we're diagnosed later in our healthcare journey, which leads to the need for more interventions over time. So this community-based approach allows us to go in and say, what are the things that you need? How can we address all of these social determinants of health? Is it that you need career counseling? Is it that you have some food insecurity? We go in and we work with these individuals because the community-based organizations know more about that area than anyone else. I always say in public health, if you really want to go into a community, you need to work with those that are already there and have been fighting the good fight for equitable care for a long time. Assistance organizations can partner with clinics to assist with daily living costs and expenses, providing transportation to medical appointments, but it's all about making those connections. If we just think about the economic stability part, that one factor of social determinants of health, 1 in 10 Americans live in poverty, which makes it difficult to afford their health care, housing, and food. If they're food insecure, then they're going to have worse healthcare outcomes. But if you bring in the right partners to address those needs, you have a better chance of making an impact. So independent charitable patient assistance organizations are standing in the gap. We are saying, what can we do to address these factors within our tight budgetary and regulatory guardrails that's going to truly give the patient some relief along the way?
Thank you so much. So how do you both recommend measuring the success of a patient assistance program for addressing the needs of the underserved populations?
It's always going to be data, right? Data is going to always tell a story. So review the demographics of those that you are serving and compare it to the data of those impacted by a particular condition. So if diabetes, for instance, is one of the conditions that a patient assistance program is aiming to address, what does the national data look like? What does the local level data look like? Does it tell us who is primarily impacted by that condition? And then if you look at those that you're serving, what does it tell you? Does it align, and are you truly meeting those inequities? I think if we look at those that have a higher prevalence rate and a higher mortality rate, then we are able to reach our target populations.
And Craig, I see you over there shaking your head.
Yeah, I think that the data is critical, and I think that includes sort of qualitative inputs as well. You know, it's important that we find opportunities to really listen to the experiences of those populations that we're serving, not just in terms of, you know, did you get your support in a timely manner and that sort of thing, but what are some of the other challenges that you're experiencing that may create barriers to you getting the result that you want from treatment? And you know, one of the things that Accessia Health has done a lot of work in is going out and talking to advocacy organizations, patient groups that are really at a ground level, seeing and understanding what's going on amongst those populations, so that we may be able to identify other supportive needs or other types of assistance that may be particularly relevant in that disease area. And so as we look to, you know, provide support services, we do it in that holistic way that Tiara was talking about by, really looking at a variety of factors that may impact, somebody's ability to really access the care and treatment that they need.
Thank you. Well said, both of you. Really great points. And so glad you brought up the importance of the data. It was on my mind from the moment you highlighted the $1,000 range as being too expensive. And then, Tiara, you mentioned pharma companies, or maybe it was you, Craig, mentioned the pharma companies thinking $2,000, yeah, no big deal. Having that data is the first step to addressing all of this. So I'm so glad you brought that up. I've seen some really great questions starting to populate in from the audience, and I know we are coming upon the end of the broadcast, so I want to kick things over to the Q&A if you don't mind. But before we start off with our Q&A, I want to remind our audience how they can submit any questions they have for us to review. I also don't want to discourage anyone if we do not review your question live today. Your questions will also be reviewed and responded to offline. So that said, before we kick things off, if you'd like to submit a question to our presenters, you can put it in the Q&A box that can be found directly below your video player. So our first question today, how can collaboration between the stakeholders, I know we mentioned industry, the healthcare providers, we have the payers here, even the patient advocacy groups that you just mentioned, all of these different stakeholders sometimes complicate things. How can we have them all work together and contribute to the overcoming access challenges we're talking about here?
I think it starts locally, right? It's more difficult to start at the national level, but if we address those community needs, overcoming access challenges become a collaborative effort. So it's not necessarily one or two of those entities, but it's going to require a system and policy changes. We have some deeply rooted injustices that fuel health inequities in this country. So if we look at the social determinants of health and ensure that each of those factors are addressed equitably, then we can really overcome some of those challenges. And I talked about that a little bit in the Louisville, Kentucky program that we're working with. We're working with faith-based organizations. We're working with the churches because we know that that is where their trusted advisors are. That is where they are. So we are meeting them where they are, and we're saying, how can we get them into care in a way that's going to make sense for them, working with those churches, working with community health workers in health systems and universities, so that we are all chiming in and making this collaborative effort to improve the outcomes. Yes, that's starting locally, but there are some system changes that goes into that for those hospitals and other organizations that are involved. And ultimately, we hope that it gets to some type of policy change, whether it starts locally, goes to state, and goes to federal. We could do nothing but collaborate and do our best.
Thank you. So my next question, someone asked about, if they're developing strategies to improve access, in what ways do organizations ensure that their strategies for improving the access don't only just prioritize health equity, but make sure that they're being effective in overcoming these inequities that we've highlighted so strongly today?
Use your resources. The Centers for Disease Control, CDC, has great resources on addressing health equity, and they're research-based strategies. It's not that we are trying to make things up as we go along. Let's not reinvent the wheel. What has been proven to be successful thus far? The needs of each population are going to be different, but if you adapt your outreach and intervention to meet those needs, then you're more likely to be successful. The needs of an urban population, as Craig was talking about earlier, are different than those in a rural area, and involve those community-based organizations so that you're aiming to serve as many individuals as possible.
Great, thank you. So at the end of the discussion, we really emphasize the importance of data. In what ways can all of the insights that Craig shared with us today, all of these trends, be used to then address or even hopefully preempt the access to some of these barriers we've mentioned?
Yeah, I would say, one of the things that we can, and I think within the community of patient assistance programs, there is a level of collaboration and collegiality where, we share information and insights that we think can improve our ability to better serve patients. And, at the end of the day, I think it's going to be important that we not just look at trends and data points, but that we consider how those translate into experiences and outcomes. Because oftentimes healthcare can be a very transactional kind of experience where, we're focused on, well, that person got their medicine, or that person didn't get their medicine, or that person made it to their appointment or didn't make it to their appointment. But we're not thinking about everything else that's going on around it. And things like mental health, for example, can have a significant impact on a caregiver. And that caregiver, if their health is not in good shape, may not be as attentive to the needs of the child or loved one that they need to get to an appointment, or they need to make sure is taking their medicine. And so I think it's that sort of holistic perspective that we all need to adopt. And that includes, the pharmaceutical companies and how they're approaching supporting patient assistance. It includes the patient assistance providers. It includes healthcare professionals. All of us really need to be contributing to that conversation so we don't get lost in the data points and forget about the fact that at the heart of this are human beings who are experiencing very different things in their daily lives. So I would say, that's an important thing we need to be doing.
Great, thank you. So one last question to wrap up this discussion, and it kind of follows what you just said, Craig, about the involvement from various parties. Now, considering the pipeline and the future, I know earlier we spoke about what we're seeing in terms of trends of drug development in the pipeline there, and these more precise therapies, individualized care, tailored. So considering what you're forecasting toward the future landscape, what are your considerations on the future landscape specifically as it relates to patient assistance and its impact on healthcare access?
It's a loaded question, right? There's always, unfortunately, going to be a need for patient assistance, financial assistance, unless we change the overall healthcare system. That's the reality. People will still need funding to afford their health care. And even while those IRA caps are at $2,000, it's still unaffordable. And especially for those that we serve, rare conditions cost far more in funding than other chronic conditions. And we still are yet to really understand how this will play out. And will there be an impact on overall health insurance costs? Will it lead to rate increases, higher out-of-pocket maximums, strict formularies? There's so many unknowns, but if any of those things happen, then we have a greater need for patient assistance.
Yeah, and I would also say, as we think about these advanced medicines, they are more costly, but their impact can be more transformative at the patient level and can help to avoid a lot of downstream costs that otherwise that patient and family and the health system would have to bear. But also in thinking about how to best utilize those types of treatments and provide access to those types of treatments, we have to start thinking about other areas of support. So we talked about genetic testing, for example, making that more widely available for patients, and thinking about things like travel costs And also, in areas like rare disease, oftentimes there may not be an approved treatment, but there might be a clinical trial. So how can we help get underserved patients better and more inclusive access to clinical trials so that they can benefit from whatever the latest treatment is that's available? So I think, it's exciting in a lot of ways what's coming down the pike and some of the advancements that we're seeing from a treatment perspective. But that's only as helpful as our ability to make sure that those advancements are accessible to every patient who needs them.
I'm so glad you brought that up, Craig, because as you started speaking, I started thinking about molecular screening assays as well. It isn't just therapeutics, but again, as you both alluded to, some of the other costs that we don't even consider beyond drug development that are happening with some of these new innovations in research.
Well,
thank you so much.
Yeah, thank you. I was just going to add, like that's I'm glad you brought that up because it relates not just to some genetic conditions, but also in areas like Alzheimer's, where the newer treatments that are coming out are going to benefit patients most if they're diagnosed early on. So giving people access to the right types of testing and screening there is going to be important.
So you're talking
cancer,
about access.
Right?
Yeah, we're talking about access, but how will they even know about it, right? If I'm not getting to my doctor in general, who else is going to tell me about this information?
Well said. Thank you both for your time and your insight today. This was really great presentation. I'm so glad we had time to speak with both of you. Brought up some really great information. I really loved some of the data that you brought in, really made me kind of, scratch my head as well. So I'm really glad that you were both able to participate and provide some insights today. I'd also like to thank our audience for attending and participating. And I'd like to thank Assessia Health for making this educational webcast possible. We are going to conclude, but before we do, I'd just like to ask our audience, they wouldn't mind participating in a brief survey. It'll populate on your screen just after the presentation is concluded, and we really, truly appreciate any insight you have. You'll also receive an email alerting you when this presentation is ready for replay, and we invite you to forward that announcement on to any colleagues who may have missed the event live today. So again, thank you to everyone for joining. We'll see you next time. Bye, guys.
Thank you.
Thank you.